care that has disparities is poor care, full stop. Meaning if the care is not equally delivered, it's just not good care. No matter how good quality care at baseline it is, it's not good care because it's not equitable. Whether that disparity is system related or individual implicit bias related, it simply should not be there, should be eliminated. There's so much to do, and we can talk again for hours about this. But in my mind, there are a few key points. One is raising awareness among clinicians and patients. Number two, measuring disparities. Measuring is the emphasis on measuring. Measuring disparities in every aspect of care we provide is key. I call it the disparity check. We measure results in a lot of areas of medicine and healthcare, and every time we should do it, it should be second nature to us to measure disparities in that aspect of care and call it the disparity check. And the third one is standardization of care when feasible. And it's a little bit more controversial and maybe not as self-evident to most. I was in charge a few years ago of decreasing unnecessary opioid prescription after surgery. So like I told you, I'm a big fan of measuring everything we do. So I measured at baseline, how are we giving opioids to our patients? And I did the disparity check. And I was unfortunately clear in the data that we have disparities in how much opioid pills to give. These disparities were gender related disparities as well as racial related disparities. But the more important aspect of that is, after the big initiative we did, and part of it was standardizing based on the procedure and patient characteristics, how many pills every patient should get after their surgery, we measured disparities again. And in addition to the fact that we decreased the prescription of opioids in general, the prior existing disparities that were there for years just disappeared. The point is, when we standardize care, where the care is provided irrespective of somebody's gender and irrespective of somebody's race or ethnicity or cultural background or religious background or sexual orientation, then that care will become better because that care will focus more on what the patient needs without letting room for implicit bias to find its way.